All right, let's talk about it. We're going to break down the real clinical facts behind those cyclical symptoms that can just completely disrupt your life every single month. It's a pattern so many people recognize, but very few really truly understand. So let's get into the science behind it. So, does this sound familiar to you? That feeling that just like clockwork, this wave of physical and emotional changes hits you, only to disappear just as mysteriously a few days later? I mean, it can feel so frustrating, so confusing, but there is a clear clinical pattern here, and today we are going to unpack it. Yeah, this list probably looks pretty familiar to a lot of us. We're talking about the whole shebang. Mood changes like irritability and anxiety, plus all the physical stuff like bloating, headaches, and that deep down fatigue. But you know what? The real clue for a diagnosis isn't what these symptoms are, it's when they happen. Okay, so let's get a precise definition. What are we actually talking about when we say PMS? We need to move beyond the jokes and the stereotypes and get to the clinical reality. So here it is. PMS is defined by this crucial timing. It's a collection of symptoms that consistently show up during the luteal phase. That's the roughly 2-week window right after ovulation and before your period starts. And then, this is the important part, they get better once menstruation begins. The pattern? Well, the pattern is everything. But here's the thing, not all experiences are the same. It's really a spectrum, and on the far end of that spectrum is a much more severe, sometimes disabling condition. This is where we have to draw a really clear line between PMS and its more intense counterpart, PMDD. And this just lays out the difference so clearly. With PMS, symptoms are, mild to moderate, and you can generally manage them. But with PMDD, that's premenstrual dysphoric disorder, the symptoms are so severe, they cause what doctors call functional impairment. That just means they seriously interfere with your work, your school, your relationships. And the absolute key difference, as you can see, is that PMDD requires at least one major mood symptom to be front and center. So to actually get a PMDD diagnosis, the checklist is super specific. You need at least 5 symptoms in total. And crucially, one of them has to be a significant mood symptom, like severe anger, depression, or anxiety. The timing has to be precise, showing up in that final week before the period. And the impact on your daily life has to be significant, no question about it. So, what is actually causing all of this? Well, this is where a major myth gets totally busted. For decades, the thinking was a little off base, but now the science is a whole lot clearer. The thing you always hear is that people with PMS or PMDD must have wacky hormones. Too much of this, not enough of that. I mean, it seems logical, right? But the clinical evidence, it just doesn't support that idea at all. And here it is. This is the real story. It's not about having abnormal hormones. The science points to an increased sensitivity to the completely normal rise and fall of hormones during your cycle. It's the sensitivity that messes with your brain chemistry, things like the neurotransmitter serotonin. So the trigger is normal, but the response is amplified. That is the key. Okay, so if the diagnosis depends entirely on this timing and these patterns, how do you actually confirm it? This part requires a little bit of detective work, and it's something you can be an active part of. The entire diagnostic process, the gold standard for figuring this out, it really boils down to this one number: 2. Because that's the key. The way to know for sure is prospective symptom tracking for at least 2 full menstrual cycles. We're not talking about a blood test or a scan. We're talking about a diary. This is what creates that clear map, showing if your symptoms are truly and reliably locked into that premenstrual window. Part of being a good detective here is also ruling out other conditions that can look a lot like PMS or PMDD. Things like underlying anxiety disorders, thyroid issues, or even chronic migraines can have symptoms that overlap or just get worse before your period. A proper diagnosis makes sure we're treating the right thing. Okay, so what do you do about it? The good news is there is a clear, evidence-based action plan. The approach is stepwise, which just means you start with the basics and you build from there as needed. This stepladder approach is incredibly practical. You start at the foundation, step 1.
Lifestyle changes, like regular exercise and stress reduction. If you need more, step 2 adds targeted basics, like NSAIDs for pain, or even calcium supplements. Then, step 3 brings in powerful tools like CBT for mood symptoms. Step 4 is where you might explore hormonal options, like certain birth control pills. Now, for severe PMS, and especially for PMDD, step 5 is where SSRIs come in as a first-line medical treatment. And finally, for the most challenging cases, step 6 is about getting referred to specialist care.
So, if we just boil this all down, here are the absolute key takeaways. First, remember the cyclical pattern is everything. It's the single most important clue. Second, PMDD is a severe, distinct condition, and it's defined by those mood symptoms and how they impact your life. Third, a 2-cycle diary is your gold standard for confirming the diagnosis. And finally, treatment is a logical, stepwise process. You don't have to jump to the top of the ladder right away. And that brings us to our final thought. Now that you have this clinical framework, what's one pattern in your own life, or maybe in the life of someone you care about, that you can start looking for with a little more clarity? Because understanding the pattern, that is the first and, honestly, the most powerful step toward taking action.